The children. Lots and lots of dead children, mutilated children, and also children who are carrying AK-47s and pistols, and they're pointing them at you. You're never sure if they're going to pull the trigger. You know, who do they belong to? What side are they on? How do they view me? Terrible, terrible times. Yeah.
The one thing that as a person probably affected me the most was the children's hospital. Most of the staff, when violence took root, basically left. And these children were sick to begin with. You know, a lot of them had acute illnesses. Some of them had mental health issues. Some of them were just babies, and they were left. Eventually, some nurses and a doctor heard about this, and they went in and basically took over this hospital. They didn't have any supplies. They didn't have the staff to man it. They barely had any food. So when the Canadians heard about it, we gave them a generator. We brought in some water, some food, and we just kind of checked on them to make sure they were okay. But when you went into that hospital, I mean, the smell stays with you. I mean, it is. When people say that it smells like death, that is exactly what it is.
What, you want this guy?
Not only, you know, at a physiological level, it affects you because that kind of smell has a physical reaction in your body. But then when you start walking the hallways and you see who the patients are, who these dead bodies are, I mean, it's kids. Missing limbs. You can see gangrene sitting in on a lot of these kids. Some of them are so malnourished. Lots of crying, and some of them just can't even cry anymore, right? They've been there for so long, they're so tired, they're so near death. And it's amazing, some of them just want to be held. Like even my troop horn and myself, we picked up a couple of these babies and they just want to be held. You know, they quiet down and you walk by them and they reach out to you. Even if you're brought in a modern medical facility, you wouldn't be able to help some of these kids. They're just that done. And then to see, you know, this handful of people trying to do the best of a really bad situation. We had a few guys who just couldn't handle it. You know, they had to leave. Parents, you know, both of them. Guys breaking down, and it's overwhelming. I think if anything, it helped to focus. You know, why we're there. The battle group is a warfighting machine, but in that moment we felt we had even a bigger calling. You know, we went into Bosnia almost looking for a fight, and we realized that the fight looked a little bit differently there. We were willing to fight if we needed to fight, but that our energies were spent better elsewhere. And mainly to stop that from happening again, and secondly, to help these people in whatever way we could.